Imagine this, it's 3000 BC and you just broke your leg. How would you fix it? Well, since there was no such thing as an orthopedic surgeon or an MRI machine, you might have turned to animal skins, sticks, and muddy. Yep, that's right. Some of the earliest humans who lived during the prehistoric era relied on these materials to help heal broken bones. During this time period, which lasted from roughly 2.6 million years ago to 4000 BC, humans were still learning how to control fire and create tools. As a result, the treatment of broken bones was a pretty primitive affair. However, even in this time period, people did develop some pretty ingenious solutions to this common problem. For example, one group of prehistoric humans living in what is now South Africa used animal skins to create a kind of bandage to wrap around broken legs. Another group living in Europe used sticks and mudi to create a splint. This type of splint could be made by first cutting a stick into two pieces and then wrapping the injured area in mudi. The stick would then be placed on either side of the break and the whole thing would be bound together with animal skin. While these methods may seem pretty brutal by today's standards, they actually had some merit. Keeping the broken bones immobilized is still a key part of treating fractures today, and these early humans had figured out a way to do just that. As civilization developed, so did the treatment of broken bones. In ancient Egypt, broken bones were treated with a variety of methods depending on the severity of the injury. For less serious breaks, bandages were used to keep the bone immobilized while it healed. More serious breaks required surgery, and the Egyptians had developed some pretty advanced tools for the time period. These included saws, forceps, and even a rudimentary form of anesthesia. Anesthesia was typically in the form of wine or opium, which was given to the patient before surgery. While this may not sound like much, it was actually quite innovative for the time period, as it allowed the patient to be more comfortable during surgery and reduced the amount of pain they felt afterwards. Surgery itself was performed by a team of priests and doctors, and the incision was made with a sharp piece of stone or metal. The broken bones were then set and secured with a bandage or splint made from wood or leather. After surgery, the patient would be given herbal remedies to help with the pain and promote healing. These remedies often included ingredients like cannabis, willow bark, and poppy seeds, all of which have pain-relieving properties. Ancient Egyptian beliefs about the human body were also quite advanced for their time. They believed that the body was composed of 4 humors, which needed to be kept in balance in order for a person to be healthy. This is actually quite similar to the modern understanding of the human body and its different systems. As a result, the Egyptians were able to develop some very effective treatments for a variety of ailments, including broken bones. While many of these treatments may seem strange to us today, such as the use of animal parts in some remedies, they were actually quite effective in many cases. And the Egyptians were some of the first people to really understand the importance of keeping the body in balance in order to heal. In ancient Greece and Rome, broken bones were treated by some of the most famous physicians of the time, including Hippocrates and Galen. Hippocrates, who is known as the father of medicine, developed a technique for setting broken bones that is still used today. He believed that the bone should be set as soon as possible after the fracture occurred, and that it should be immobilized until it had healed. This is actually quite similar to the treatment of fractures today, and it was a very innovative approach for the time period. Hippocrates also believed that the body had the ability to heal itself and that medical treatment should focus on supporting this process rather than trying to cure the disease. He recommended the use of herbal remedies and massage to help reduce pain and swelling and promote healing. His approach to medicine was very holistic, and he considered the whole person when making a diagnosis and developing a treatment plan. This included taking into account the patient's physical, mental, and emotional well-being. Another Greek physician, Galen, was a prolific writer, and his work on anatomy and physiology was highly influential during the Middle Ages. He believed that the human body was composed of 4 humors, as did the Egyptians. And he developed a theory of disease that was based on the balance or imbalance of these humors. He also developed a system for classifying wounds and injuries, which was another innovation that helped improve the treatment of broken bones. While both Hippocrates and Galen made significant contributions to the field of medicine, their work was not always accurate. For example, Galen's theory of disease was not always correct, and his work on anatomy was based on the study of animals rather than humans. However, their ideas did help lay the foundation for modern medical practices, and their influence can still be seen today. But it wasn't only in Egypt, Greece, and Rome where people developed innovative ways to treat broken bones. Around the world, indigenous cultures developed their own unique techniques for setting and treating fractures. For example, in Central America, the Maya and Aztec people used a variety of natural materials to treat broken bones. These materials included bark from the bromeliad plant, which they used as a kind of splint, and the sap from the avocado tree, which they used as a painkiller. They also had a deep knowledge of herbal remedies and used a variety of plants to treat pain and infection. The Inca people of South America used a similar technique, often using the leaves of the coca plant as a painkiller. In many indigenous cultures, the treatment of broken bones was also a spiritual practice. Shamans or other healers would often perform rituals and ceremonies to help the bone heal properly. This may have involved the use of herbs, prayers, or even blood transfusions. For example, the Yanomami people of Venezuela and Brazil have a tradition of performing a ritual called the mastema after someone breaks a bone. During the mastema, the healer will make an incision in the affected area and then suck the blood out of the wound. This is done to remove any evil spirits that may have caused the injury and to allow the bone to heal properly. While these practices may seem quite different from the methods used in Western medicine, they are all based on the same goal, which is to help the patient heal and recover from their injury. No matter what culture you live in, a broken bone is a serious injury that requires treatment. And no matter what methods are used, the goal is the same: to help the patient get back on their feet as quickly as possible. So how well did these ancient methods work? Well, we can get an idea by looking at the Iceman, a man who died in the Italian Alps around 3250 BC. Tsitsi's body was found remarkably well preserved in the ice, complete with his clothes and personal belongings. He also had a number of healed fractures, which suggests that he had survived at least 2 separate breaks during his lifetime. One of these was a simple fracture of the right clavicle, which is the bone that connects the arm to the shoulder blade. This type of fracture is fairly common and usually heals well on its own. The other was a more complex fracture of the left femur, which is the thigh bone. This type of fracture is more serious and often requires surgery to repair. But it appears that Ötzi's body had managed to heal properly, suggesting that whatever treatment he received was effective. Unfortunately, we don't know exactly what treatment Ötzi received for his fractures. He was found near a cave that contained a number of primitive tools, including a walking stick and a flint knife. It's possible that these tools were used to set his bones and help them heal, or it's possible that he received more sophisticated treatment from his community members. Either way, his story is a remarkable testament to the human body's ability to heal itself. Today, the treatment of fractures has come a long way from the rudimentary methods used in prehistoric times. Most simple fractures can be treated with a cast, which is a rigid external device that immobilizes the broken bone while it heals. More complex fractures may require surgery to repair the broken bone fragments. After surgery, the patient will typically be given antibiotics to prevent infection and pain relievers to manage pain. Once the bone has healed, the patient will likely need to undergo physical therapy to regain strength and mobility in the affected limb. While these treatments are much more advanced than those used in the past, they are still based on the same principles. The goal is still to immobilize the broken bone and allow it to heal properly. And the goal is still to help the patient recover as much function as possible in the affected limb. Whether a patient receives a cast or surgery, it is important to follow the treatment plan carefully in order to ensure proper healing. This means keeping the affected limb immobilized, taking antibiotics as prescribed, and attending physical therapy appointments. Following these steps will help minimize the risk of complications such as infection or delayed healing. It will also help ensure that the patient makes a full recovery and is able to return to their normal activities. So next time you break a bone, count yourself lucky. You're not stuck in the Stone Age. Now, it's your turn. What do you think about ancient healing methods? Leave your thoughts in the comments below.